so much.
Good evening, everyone. My name is Missy Baker. I'm the chair of the Human Services
This conference
Board.
will now be recorded.
So we will begin our meeting. So welcome to everyone. I would like to do a quick roll call to make sure that everybody is here. Dr. Batt, Jeff Broadway, Annette Desai, Earl Ford,
Present.
Meg Harkins,
Here.
Richard Helms,
Here.
John Laranzana,
Here.
Jesse Lindberg,
I'm here.
Eunice McGee,
Here.
Dr. Smith, I think I see you on, but I can't hear you.
I'm present.
Okay, thanks. Megan Smith
Here.
and Dr. Moss. Did I miss anybody? All right, we will move forward with the pledge. So if everybody would join me in the pledge of allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. John, if you would do the invocation, please.
Thank you. Dear Lord, thank you for all the gifts that you've given us here today, Lord. All the talents that we have and all the people that we have to work with here in this county. We ask, Lord, that you bless all those present in this meeting, bless all the people of Union County and those that we intend to serve. Bless all the sick, bless all the people taking care of them. Bless all the underserved and underprivileged and those that help provide care and services for them. Help us to understand what we're here to do tonight and help us to make good decisions for the good of our neighbors. We ask all these things in your name. Amen.
Amen. Thank you, John. So as far as the approval of minutes, we will defer that into the November meeting. Just wanted to make sure everybody was aware. Do I have an approval for the agenda? I know that I have to take a roll on that for the approval. So we have a motion? Okay. So I'll take the roll call. Dr. Batt, did he join? Jeff Broadway? Annette Desai? Earl Ford?
Aye.
Meg Harkins?
Aye.
Richard Helms?
Ah.
John Laranzana?
Aye.
Jesse Lindberg?
Aye.
Eunice McGee?
Aye.
Dr. Smith?
Aye.
Megan Smith?
Aye.
And Dr. Moss? All right, thank you. So we will move to the old business. There's not any old business that I'm aware of and that's on the agenda. So we will move to the executive director's report. Michelle?
Yes, thank you, Missy. In your package, you had several applications for the board. I am not going to ask you to take action on those recommendations tonight, but what I did want to go over with the group is what the Consolidated Human Services Board membership looks like. This is obviously a higher number of applicants than we've seen in the past, so I want to make sure that we're all on the same page with how we move forward with making the recommendation to the Board of County Commissioners, and then I'll be happy to answer any questions that you might have. The statute for a Human Services Board, a Consolidated Human Services Agency Board, calls for no more than 25 members that should reasonably reflect the population makeup of the county and include persons as set forth in general statute. It's 153A-77, if anybody is interested in looking at it in more detail. The Board of County Commissioners in Union County has made the decision that we would have 18 members plus a member of the Board of County Commissioners, which is called for by statute. And that's the role that Commissioner Helms fills on this board. And so I'm going to go actually through the membership as you all serve, and then I'm going to highlight the vacancies that we have. We have 6 vacancies currently. So we have Dr. Jeff Broadway, who serves in the position of veterinarian. Veterinarian is a position that is called for by statute. So if I reference a position, that is because it is called for by statute to be a position on this board. And we have Eunice McGee, who serves in the social worker slot. Eunice is a retired and proud social worker from Union County, and we appreciate the perspective that she brings to the board. And then we have Earl Ford Jr., who serves in a consumer of human services slot. So Earl receives services through our Veteran Services Agency, which is obviously a department that makes up part of our Human Services Agency in Union County. And then we have Mr. Desai, who serves in the pharmacist role. Again, this is something that a actual position that is called for in the statute. We have Dr. David Perry Smith, who is a physician and serves in the physician role. And so the statute calls for 2 physicians, one that must be a psychiatrist. And so psychiatrist is actually vacant currently. So you'll hear me mention that in 1 second. Megan Smith serves in a role that the statute actually calls as other person. And so it calls for folks who represent other professions and other parts of the community. And so Megan, when she applied, filled that type of position on our roll. Jessie Lindberg serves from the community-based organization representative. So her role as executive director of Turning Point is how she has applied. Although I think, Jessie, you would probably fit several different components of this. And so you bring a wide perspective to the work that we do. And then Missy Baker, who currently serves as our chair, is a registered nurse, works with Atrium, and serves in that slot that is called for by statute. John Laranzana serves in the other person category, just as Megan Smith, as I referenced earlier. And then we have Dr. Batt, who is an optometrist. An optometrist is a role that is called for by statute. Meg Harkins is an engineer and serves in an engineer slot. Again, engineer is called for by statute. And then we have Angela Thorpe Moss, Dr. Moss, who is a psychologist who fills the role of psychologist. And so the 6 vacancies that we have are psychiatrists that I mentioned earlier. We have a vacancy in dentist. We do not have a dentist currently who serves on this board. We have 3 consumers of human services that are vacant. And so that can actually be a consumer themselves, or it can be a family member. And so that is a slot that we frankly have, as long as I've been here for a little more than 6 years, have had a difficult time filling. And so I think that's one that we'll continue to look for folks who meet that criteria. And then we have 1 other person slot, and that is actually a slot that was most recently filled by Luis Durrani. I think you'll all remember Luis and his role that he played. He filled an other person slot. So just to recap the 6 vacancies, we have 3 vacant consumer of human services slots, so consumer or family member, a dentist vacancy, a psychiatrist vacancy, and an other person vacancy. So that can be more of a catch-all. So when you look at the 8 applicants that you have, what we have done in the past, and that I will plan to do before our next meeting, unless you provide a different direction, is that I will reach out to them. I'll probably do this with staff. I think I'll have Janet help with this process. We'll reach out to those folks, talk through their application, also go through these criteria that I just laid out for you of the 6 vacancies, and then bring those back to you at your next meeting and align them with the vacancy that they might align to in order to even make a decision to recommend those positions going forward to the Board of County Commissioners. And for those folks who are listening and to the meeting tonight, the process for this would be that the Human Services Board will make a recommendation on applicants to the Board of County Commissioners, who would then make the final decision on those membership positions. So I'm happy to answer any questions or provide any clarification if I can, but that would be the direction that I plan to go in before our next meeting, unless there is a different direction that you desire.
Thank you, Michelle. Any questions for Michelle? related to the board applications. I appreciate you sharing just the details that you did. So do we have anybody that would like to make a motion to defer that to the next meeting when we can reach out to these applicants?
This is John.
All right.
I'll second.
Okay.
Thank you. And I'll take a vote by calling the roll. Missy Baker, aye. Earl Ford,
Aye.
Meg Harkins,
Aye.
Richard Helms,
Aye.
John Laranzana,
Aye.
Jesse Lindberg,
Aye.
Eunice McGee,
Aye.
Dr. Smith,
Aye.
Megan Smith,
Aye.
and Dr. Moss. I don't think she joined us. Okay, thank you so much. We will move to the division reports, the dental clinic overview.
Hello, hi, I'm Candace Crow, and I'm the dentist here at the dental clinic. And I do have a PowerPoint if someone is putting those up.
I'm working on getting that up, I think. So
Okay.
let's see how this works.
There we go.
I don't see it, but it says that I'm sharing my screen.
I see it on mine. I'm not sure.
I see it also. I see it.
Okay, you can see it. Okay, maybe I just can't see it because I can see all of y'all.
I'm not sure how big the slideshow
not
is
big.
for everybody.
Let's see here. How about that?
There we go. Okay, great.
All right, just tell me when to click to the next slide, okay?
Okay, very good. Thank you very much.
You're welcome.
Welcome to the dental clinic. It's sort of a virtual tour, I guess, tonight, which is what we're used to lately. If we had been in person, I gladly would have offered anybody a tour after the meeting if they had wanted one. So feel free to let us know or come by. Just give a call and we'll give anybody a tour. We are located, for anyone that does not know, on the main floor where patients come in from the parking lot. They come in the door, turn to the right, and we're right down the hall. We opened April 8th, 2019 in this building. We previously were in the old building, but the new clinic here didn't open till April 8th, 2019. With COVID, of course, we did close briefly, like all dental offices did, from Tuesday, March 17th, and then we reopened May 11th. We were one of the dental clinics that did ramp up earlier than a lot of others in the state. We just had a great need, and I wasn't comfortable keeping it closed too long. We did, of course, use all the safety precautions, shields and masks and gowns, which gloves we always used. But we also added some new equipment, which was these very large extraoral suction machines, which would filter out all the aerosols in the room, which is where COVID was causing the problem, spreading airborne with the aerosols. So we did, get things going pretty quickly. Also in the dental clinic this March, we had a new Nitrous Oxide system installed. When we first opened, it was a portable unit that we had to kind of wheel from room to room. And we now have it directly plumbed into all of our 5 operatories, which is very convenient and much more efficient. Okay, next slide, please. So you can meet the dental staff here. We are small, but we work hard and try to be as efficient as possible. The first person on the left is Miss Laurie Emmert. She has been a dental assistant for 39 years. She actually opened the dental clinic here for Union County, the first one that opened in 1999 in the other building with Dr. Walters and Dr. Johnson. who kicked off that clinic. And Dr. Johnson has previously been on our Human Services, previously Board of Health board. I'm in the middle in yellow, that is me, and I've been practicing for 25 years. Next to me is Miss Lisa Austin. She's our hygienist. She's been practicing 32 years. And then over in the check-in window is Maria. She is new to directly being in dental since we opened, but she did work for 14 years in health promotions and community outreach and did a lot of dental programs out in the community. Next slide, please. We see both children and adults starting at age 1. So we have a nice span of everybody that we see. Next slide, please. We do offer the basic services: exams, fillings, x-rays, sealants, extractions, partials, dentures. We don't do the high-end stuff, implants, porcelain crowns, of that nature. Next slide, please. We do go out into the community for dental education and screenings. We're just starting to very slowly get back into that due to COVID. But prior to COVID, typically on Thursday evenings, we would go out into the community, typically at school libraries, and we would give a dental education class to the parents, and we would do dental screenings on the children, and then review with the parents what the findings were. And also our dental hygienist and Lisa and Maria, they also went into the schools in the morning and they would give dental education presentations to the elementary children. Next slide. This is just a chart. It's called a Perio Chart, and it just shows how we can measure how someone is doing. And where this comes into play is with when people get their teeth cleaned. So these numbers are measuring the different pocket depths, and the red is showing numbers we do not like. We don't like them being deep, and the black numbers are showing healthy numbers. So we are able to actually measure the progress of somebody. And so the top chart is the first one that has much more red, and the second one, after their cleaning and education, they have improved. And a lot of patients get very excited to come back. They work very hard after they've been educated on what to do, and they're very excited to see if they've progressed in a good, positive way. Next slide. Okay. This slide might be a little confusing. I'll try to make it as basic as I can. The first two orange bars, it says Comp Ad and Comp CH. It's a comprehensive, and AD is for adults. So that is the number of patients that we have, appointments that we had from August for 1 year, August 2020 till July 21. So as you can see, we do have more adults than children. So the two orange are comprehensive appointments for both adults and children. The next is the very small ones are emergency adults and emergency children. Those are smaller. During that year, we weren't able to take as many new adults in just because we were very full in the clinic. And for children, we always accept children in no matter what the situation is, but most often we just offer a comprehensive exam, even if it's just a toothache, and parents usually opt to go that direction. So we typically don't just service the patient with an emergency situation. You see our kept appointments in green and total schedule. So we do not have a very high BA rate. The red is the interpreter. About 51% of our appointments use interpreters, which mostly would be Spanish. We do have some other languages, and we are able to, with a language line, do that. We currently use iPads due to COVID. The interpreters used to come in person, but due to COVID, we now have them on an iPad so the patient can see and hear them, and it's working very well and just helps kind of keep everything under control. Next slide. Okay. This is a slide with the total number of patients. And we are 60% adults and 40% children. When we started the clinic off, we were probably closer to about 15% children. So we have increased quite a bit the number of children that we now see in the clinic. But we are definitely seeing a great number of adults in the clinic. Next slide. This is showing a breakdown of what classification, where they're falling as far as if they have private insurance, Medicaid, sliding fee. So I'm not sure how well you can see these numbers, but the sliding fee is 64% of our patients, private insurance is 5% of our patients, and Medicaid is 31%. So what this is showing is that we are definitely a safety net clinic for adult patients, because of that sliding fee, 75% of the sliding fee are adult patients, where 25% are children, because they usually have Medicaid. And that is very important because a lot of our adult patients in the community in Union County don't always have the ability to go to a private dentist, and they often have pain. They have infection that they've had for years. Some of them have never had a chance to go to the dentist. I was kind of surprised that more than I would expect, patients will tell me as an adult, maybe a 40-year-old man, that we are the first dental visit they've ever had. So we are definitely helping a lot of people in our community that way. We are a very good safety net clinic for them. Next slide. This is just showing there are two slides. One is starting January 1st of 2020 to the end of the year, and it was showing the amount of partials, dentures, extractions, and nitrous oxide cases we have. And the next slide is showing the same thing, but it's only from January 1st to the end of July of this summer. So as you can see, we actually are doing a little more nitrous oxide cases, and that is simply because we have increased the number of children we have seen. So, and although we don't use it routinely on all children, only children that need it, we are seeing a lot more kids, and so that has increased. Next slide. Oh, there was one bar that didn't get on the last slides. I will just verbally tell you. For the year 2020, we did about 737 fillings. And currently this year, up until the end of July, we have done 612. So we do quite a bit of work here as far as fillings go, saving a lot of teeth. This last slide here is showing the deep cleanings versus the regular cleanings that adults have. And we do get a lot of adults that do need deep cleanings, and we give them education and really try to turn everything around. And we do very well in that area, and patients are very happy about that. And again, the numbers have changed just a tad because we are seeing more children than adults. So although it may look like we will be doing less cleanings on adults, it's simply because more children have filtered in. And that, I believe, is my last slide. Does anyone have any questions?
Thank you so much for sharing a lot of great information. I love to see that y'all are really increasing the ability to care for the kids and getting kids in for treatment, and so that they have less problems later on in life. So thank you for all that y'all do.
Well, thank you. You're welcome.
Any other questions? All right, hearing none, I will move on. Thank you again so much for coming and presenting for us. Dennis, are you next? Do I need to continue to show the screen?
Yes, ma'am. I'm next, and you should have. I don't know if they're in this packet, but I sent it. Yeah, there they are. Want to give a overview of where we stand currently with COVID. You can go to the next slide. And as many people have heard and have been following through the news and other places, we have been fortunate over the past month to be, well, really the last 3 weeks, I guess, to start seeing a nice decrease in the number of cases that we're seeing. Our new 7-day rolling average of new cases is now down to, 89 as of today. I know one day, I think it was Thursday of last week, we were down to around 84, 85 cases. So you can see from this rolling average, the light blue line here, that we've seen a pretty steady drop over the ending part of September and into the first part of October, which is a nice thing to be able to report on. The number of cases actually, so the 89 cases per day average is about a 31% decrease over the last 14-day change. So that's a very positive decrease. And it also reflects what we're seeing statewide and nationally for the most part. Most counties in our region are also seeing similar decrease in those number of cases. Next slide. This is the average number of daily new cases by month. And you can see that September was a large month in terms of the new cases. It was the second largest number of cases that we saw on average throughout the entire pandemic. It rivals the numbers we saw in January when we saw the huge surge back last make it to the same level, but the point I want to make here is that you'll see, while we're still just 10 days into the month of October, with our average there down into the 80s, it shows a nice drop, which is also kind of commensurate with what we saw in February of last year as well. So that's a positive piece of information as well. Next slide. This is kind of a breakdown of the percentage of our cases by age groups and age categories. And as you see, most of the age groups are have been sort of steady, flat line, so to speak, or else decreasing over the past 3 months, 3 to 6 months. The one age group that we have seen increases in is in the 0 to 17. And I think that's primarily reflected in the Delta variant being a high level of transmission that we've seen statewide, and certainly in our region and county as well. It does seem to affect younger population a little more than the earlier variants did. And so we've seen that increase reflected as well. Next slide. This is a slide looking at our region for that 0 to 17-year-old age group, and you'll see that from a regional standpoint, we are above some of the neighboring counties. We're at around 30, I believe we're around 37% of our cases are to 0 to 17-year-olds, which is a fair amount above the others in our region and the North Carolina average. Next slide. Testing, which is an important aspect to determining what our transmission level is in the community. We've seen a nice drop in that percentage over the past several weeks. It's been pretty steady. Testing volume has remained pretty high. Comparatively speaking, over the entire pandemic, we've seen some of the higher weeks of tests, as you see depicted by the bars, and then the line is the test positivity. We're now approaching 10%. We've dropped down from a high of approaching 18% back in late August, early September. We started seeing that drop throughout September, and we've continued to see that as well. Our current test percentage as of today is 10.4. So it's been a nice steady drop. The other thing I'll point out is that we're seeing this regionally as well. Almost all counties are also seeing decreased in test positivity as well. So that's a good indicator that transmission is lessening somewhat in the community. Although, our goal is to have it to 5% or under, which indicates sort of a manageable level of transmission. And so we're still a little ways from that. We clearly had reached that level back in May and June, as you see from this chart. So hopefully this drop will continue to go down to those levels that we've seen before. Next slide. Unfortunately, when we have surges, much like we saw last winter, commensurate with that, it tends to lag a little bit as an increase in the number of deaths. We did see an increase in the number of deaths. We saw 39 in the month of September, which was up from 23 in August. But you'll see back in May, June, and July, we saw very small numbers of deaths. So we're hoping that this will be able to anticipate some drops in the death numbers as we continue to see the decreasing case and test positivity. Next slide. In terms of vaccinations, which is still obviously a big point of concern and interest for us in terms of dealing with the pandemic, we want to try to certainly increase vaccinations among those who are interested in encouraging folks to be vaccinated. Right now, we have almost 58% of the 12 years and older population who are fully vaccinated. Those are the ones who currently are eligible for vaccination. Compared to others in our region, with the exception of Mecklenburg and the North Carolina average, we have a little higher percentage. We certainly would love to see it even higher, but relatively speaking, for our region, we're certainly holding our own and doing much better than a few of our other neighboring counties. So we're continuing to promote vaccinations and making that available. And another thing about this too is over the last year, with the vaccination rollout, there have been increasing providers in the community who are doing vaccinations, which has been a big benefit. There's more opportunities and availability of vaccines in various segments of the community. So it's nice to have that other assistance. Next slide. So looking ahead, there's two big things that we're spending a lot of time and energy and focus on, and one of those is booster vaccinations. Last week completed our second week of providing booster vaccinations. That has been approved for the Pfizer vaccine for the third dose for folks who meet certain criteria. Many of the individuals that we vaccinated earlier in the year in January, February, March, many of those individuals qualify for the Pfizer vaccine booster, and we certainly encourage that. We are doing boosters on, typically we have a standing schedule for that on Fridays, although there's also many of the other providers in the community are also providing booster vaccinations as well for folks who are eligible. Right now, it is only for Pfizer. We are anticipating in the near future that Moderna may be approved for booster shots, but right now it's predominantly Pfizer. The other thing that we're awaiting and planning for is approval of Pfizer vaccinations for youth age 5 to 11. That's been one group that has not been eligible for vaccinations, and it looks like that is getting closer and closer for FDA and CDC approval. And so we are going to be making plans for assisting in an increase in youth interested in the 5 to 11. We don't anticipate, I mean, obviously we had mass clinics here early on when the vaccination rollouts occurred. As many of you know, it was a very large undertaking and operation. We know there will be an increase in interest in the vaccination for youth once that's approved, but we don't anticipate that it's going to be anything like it was with the earlier vaccinations in the earlier part of the year. But we will be designating times for youth to be vaccinated if their parents and guardians are interested in that. So that probably is another couple weeks out before that final approval will be made. And that's all that I have right now for the update on COVID in the community.
Thank you so much, Dennis. I appreciate you sharing that. I'm going to turn it over to Michelle Lancaster so that she can share some additional information related to the work with UCPS. Michelle?
Thank you, Missy. I just wanted to add a few comments regarding our work with UCPS. I know that this continues to get a lot of attention in the community, and just wanted to make this group and the folks who are watching the meeting aware of kind of where we are on a couple of specific issues, and then Dennis and I can answer any questions if there are any about his presentation or my comments. One of the things that we've definitely heard loud and clear over the last week as we've worked on our new process for contact tracing and close contact identification is that there's a gap. And I don't know that it's little. I don't want to minimize the impact that has on children and families. But specifically, I think we're really good on the front end. I think the community is good on when a positive is identified, somebody tests, they're positive, they know to isolate, to exclude from school. All of that seems to be going really well. I think we're pretty good on folks understanding that, if you are positive, but you're asymptomatic, you can get a test on day 5, potentially go back at day 7. If you're positive and asymptomatic and don't get a test, go back at day 10 or the 14-day quarantine that people are accustomed to. Where we've seen a little bit of a rub really has been in that how quickly, once we know who close contacts are in the school system, how quickly can we get those folks notified and get information in their hands so that they know what they need to be doing for their child and the school system. And so we spent some time with the schools last week working to improve that part of the process. We hope to have those changes rolled out in the next day or so. I want to remind everybody this is still a process that requires human beings to do it, and it's a fairly high volume of cases. And so we appreciate everybody's grace and patience in this, but from our staff in public health, as well as the staff at UCPS, I think everybody is working to improve and do the right thing by kids and families. And so what we're trying to work to implement is a process where school nurses and school staff will be giving those close contacts information as quickly as possible once they're identified, not waiting for public health or for our state contact tracers to make that initial contact before folks are told they should be excluded and get their information on what testing and return dates might be applicable to their particular situation. So along with that, folks would be getting a letter or a document. We are also working with our public communications staff. They were finalizing late today a new infographic that parents and families and students, as well as school staff, can see, and everyone in the community, that identifies what people should expect to see. And this is specific for those folks who are in the school setting. That really is kind of a one-pager that outlines what they should expect to receive, what type of information, who they would be getting information from. So we feel like, along with the school staff, this really will improve the process. Again, I know that this can be frustrating for folks, and we completely understand that. We hear the feedback. I've gotten lots of feedback from folks. We don't want to stifle that feedback, but we are working to improve the process. And I think this will make a big difference in getting those folks identified as quickly as possible, getting them out of the school setting and understanding what the process is so that they can get back in the school setting as quickly as possible, which is one of the things that is important to us. So Dennis, I think I covered that. If you can think of anything you'd like to add, please do. Otherwise, Missy, we'd be happy to answer any questions if there are any.
I think that was good, Michelle. I did want to just mention that the modified quarantine timeframes are return after day 7 or after day 10. So I think you said on day 7 or on day 10, just for a minor clarification there.
Thank you.
Great, thank you so much. Any questions? Okay, hearing none, we'll move forward to the approval of the requested public health clinical service fees. Jackie?
Good evening, everyone. Given the frequency of which this board is asked to approve recommended fees for public health, I did think it might be useful to review how we do set those fees. And the board packet included our current fee setting policy and a list of which clinics allow our fees to slide and which ones do not. So that was in there for your review, and I'm going to kind of quickly go through what's in that policy. The fee recommendations start with the clinical program leads in public health or individual clinical providers that are requesting utilization of a specific code or service. It then is routed through our nursing director and then on to the health director. And then if their approval of that meets with what they need, they send it to our billing services supervisor, who does some research, and she will develop the recommendation for the fee. And it's then added to our public health management agenda. And then the management team will review and provide any comment or feedback. Once that approval process happens, it goes on to the Human Service Board and final approval through the County Commission. And the factors that we do look at and consider in doing the research to come up with the recommended fee include several things: are the Medicaid rate, a commercial rate, typically we use Blue Cross, a comparable peer county for public health fees when that's available, if that service is available in those counties, recommendations from the Medicaid cost reporting consultant with the state. And the internal factors that are considered in addition would be any staff involvement, both the clinical and billing services staff necessary to provide the service, and any resources necessary to provide the service, and what the potential utilization rate for that code that's being requested would be. And typically what's landed on is a 30% increase above the medicated allowable, and that's where we adjust the fee to. In the case of the fees that you are being asked to approve for this evening, they are both new fees to the public health fee schedule for the immunization clinic. These fees do not have a Medicaid rate, so a 30% increase was made from the commercial rate. And the basis for this increase was the amount of staff time involved and resources related to this particular immunization service. When you have an immunization fee, additional things such as refrigerators, refrigerator alarms, Wi-Fi monitoring for vaccine storage, and things of that nature are also included in what's being considered. Any child that is eligible for these vaccines would be given vaccine free of charge. Any child eligible would be given state vaccine free of charge. So the fee is only going to be applicable to privately insured children. So we are requesting approval to adopt the fees for CPT code 90697 at $195 and 90619 at $209 for the immunization clinic. These are state-approved vaccines and will be given to the children ages 6 weeks to 4 years of age. And the financial impact is just receiving reimbursement from commercial insurance and providing revenue for the Human Service Agency Division public health staff to assist in covering our clinical cost. So hopefully walking through that process will provide you kind of how we arrive at these fees. And I'm happy to answer any questions.
Any questions for Jackie?
Yes, I have a question, Jackie. And the question is, I know you said private insurance, but if the fee is 30% higher than the private sector, then why would someone want to come and use services?
Like I said, they factor in the amount of staff involvement in providing that service or that particular code, whatever is involved in providing the service. I can't speak to why someone would choose one provider over another.
Understand.
Jackie, one of the questions based on what Earl just said, there's no other associated fees with their visit, is it? I mean, in other words, this immunization is the only fee they pay.
Yes, sir. There would be an administration fee for service, just like there would be for anything else. And if it's the immunization clinic, that would be applied just as if you came and got a flu shot here, or with the COVID vaccine, we're applying administration fee only, but not a vaccine fee.
Okay.
Any other questions? Do we have a motion to move forward?
So move.
Is there a second?
Second.
All right, and we will take a vote by roll call. Earl Ford,
Aye.
Meg Harkins,
Aye.
Richard Helms,
Aye.
John Laranzana,
Aye.
Jesse Lindberg,
Aye.
Eunice McGee,
Aye.
Dr. Smith,
Aye.
Megan Smith.
Aye.
Thank you. Anything else, Jackie?
No, ma'am, that's it. Thank you.
Okay, you're welcome. I'm going to quit sharing my screen now. All right, we will move towards the announcement and public comments. Please remember that they have added in the chat the ones that we had signed up prior to. I do want to remind everybody that registered speakers will be called upon in the order that the requests were received. As a registered speaker, please keep your microphone muted until called upon to speak. When called upon, speakers should unmute your microphone and turn on their webcam if possible. Once you have finished providing your comments, please mute your microphone again. Each speaker must begin their address to the board by giving their name, stating whether they are a resident of Union County, indicating the municipality within they reside, if any, and stating the topic about which they intend to speak. Each speaker will have 3 minutes to make remarks. A speaker may not yield any of his or her time to another speaker, and speakers must be courteous in their language and presentation. Personal attacks will not be tolerated. John Laranzato will be our timekeeper, so he will start whenever you start, and we will start with Shalini Iyer. I'm sorry if I pronounced your name wrong.
Missy,
Yes.
if just to the speakers, I will chime in when you have 30 seconds left.
Perfect. Thanks, John. Do we have Ms. Iyer? All right, we will move to the next speaker, Danny Auslander.
She's here. I think she's trying to unmute.
Oh, okay. Are you trying to unmute? I see you, Miss Iyer. You're muted. Can you come off mute? We'll come back to you. Maybe you're having just some troubles. All right. Dan?
Hey, good evening. How are you?
Good. How are you?
Good. If you're ready, I see Shalini there, but she looks frozen. Hopefully she'll get back in a minute. But
let's check back
I'm happy
with
to
her.
speak first.
Okay, perfect. Thank you.
Okay. Good evening. My name is Dan Auslander, and I am a resident of Waxhaw in Union County. I come before you tonight to express my concerns over the continuation of the mask optional policy and associated health risks present in Union County Public Schools. To understand what I have to say, you should understand me and my family. I am an airline pilot who works full-time to keep our economy moving. I was infected with COVID last year and lost nearly a month of productive working time to recovery. I am a husband to a wonderful woman who is a mental health provider and a volunteer in our community. She is also immune compromised, and for her, a COVID infection would mean a long and painful recovery. We are the parents of 3 UCPS students, 2 of whom are immune compromised as well. My son shares the same condition as my wife and would have the same long and physically painful recovery. For my daughter, it would certainly mean a cognitive impact and loss of many days of learning. It could potentially mean seizures, lasting brain damage, or death. We also have a medically fragile senior citizen in our home for whom a significant infection would mean hospitalization. Despite these risks, my children are attending school in person as the district has chosen not to offer the virtual learning option that was so helpful last year. Additionally, my youngest son received specialized instruction through an IEP within his school day, which would not be available if he were learning remotely. All of us who are eligible are vaccinated, but this does not fully protect us from the choices of others. This is why we are asking for your help. The Board of Education's mask optional stance ignores current medical and public health best practice from the CDC and our state health department. It demonstrates a lack of concern for the safety of our children and, by extension, for our community at large. Being a leader isn't always easy, and I appreciate that this board has stepped up to accept the challenge. Now is the time to act and to make decisions that may be unpopular but are based on science and accepted best practice. As a pilot, I understand risk mitigation and choosing the best course of action even when unpopular with the public. We do this because nobody wants to consider the alternative, which is at minimum a loss of safety margin and at worst a fatal accident. This scenario is exactly the course that we may be on right now, but the fatalities have been our children, teachers, and community members. I urge you in the strongest possible terms to issue an indoor mask requirement for the county. As Mr. Joyner shared this evening, the positive numbers are up significantly within the school-age population, and within Union County, we are well above the regional average. We want our community to be safe. We want our kids to be able to stay in school where they have the best opportunity to learn. We want our friends and family to be able to work, shop, and enjoy our community, not to sit at home counting quarantine days and waiting for test results. With proper mask usage, the quarantine requirements won't be nearly such a burden to our families. Fewer children will be impacted and lose valuable learning time. Fewer adults will lose time at work, and fewer infections will mean less impact on our community. Thank you for your consideration.
Thank you. Missy Iyer, are you back?
I am. Are you able to hear me?
I can hear you now. Yes.
Thank you. Thank you. And I appreciate that little flexibility. Had a virtual challenge there, but thank you everybody so much for your time today. And thank you so much, Michelle and Mr. Joyner, for really sort of painting the picture of what is coming. The inadequate thought process by the UCPS Board of Education by putting a motion on the floor and voting for mask optional or mandate in our schools is truly a big concern. And here is why. When they discuss, they only look at the past week's numbers. That's not enough. As the Consolidated Board is putting forth protocols, is it possible to perhaps put together a list of considerations? For example, what is a forecast analysis based on current daily isolated cases? Or is the positivity rate above 5%? What does the toolkit recommend? What do the experts say? And most importantly, do you believe that those testing numbers are declining can be attributed to the lower testing that's being done because of the delays in the current quarantines and the contact tracing process? If schools are mask optional, we need to have other mitigation strategies like ventilation, like social distancing, like testing. Why did UCPS opt out of free testing? No idea. In a nutshell, if all wore masks, quarantines can be completely avoided. Only 225 would have been out the week of September 27th and 170 this past week. But we had 1,683 students out the week of September 27th and 2,253 out this past week. Wouldn't a simple yes make a difference? And most importantly, while the Consolidated Board is trying their best to put together the protocols, the Board of Education just put their hands up when it truly should have been an all hands on deck approach and worked alongside and perhaps putting an interim mask mandate. But right now, everybody is just running helter-skelter. We had 7,283 students, staff who were quarantined, who came back into the system September 13th. That has skewed our numbers. We completely level set at that point in time. The thought I leave behind is everything is a process. What can we do to ensure the Board of Education is truly looking at the bigger picture? And how about creating a level set? 5% and below positivity rate, mask optional. If it's above, it has to be mandated. Let's work together to create a safe school environment. And we plead for you to help us make this happen in some form or the other. Thank you very much.
Thank you. Andrea Coleman.
Hi, I'm right here.
Okay, great.
Great. My name is Andrea Coleman. I'm a resident of Waxhaw, and I'm here to address masking in our schools. I've had the pleasure of spending 17 years of my life in the field of education. Being a teacher is not just a job, it's a passion, and I fully expected to stay in education until retirement. In March 2020, all of that changed, and I, along with my colleagues, had to finish the year teaching remotely. I'm extraordinarily proud of the connection I had with my students despite having to complete the school year. My name is Andrea Coleman. I'm a resident of Waxhaw, and it is heartbreaking for me that I have yet to return to the classroom. You see, last year, I knew to keep my position, I would have to teach over 600 children face-to-face with minimal social distancing, and at the time, no vaccine. I would also have to be available to stay home with my own 2 children should they be exposed. I could not knowingly place my high-risk family in that situation, nor did it make sense for my husband, our main source of income, to miss work if our kids got sick. So as a family, we were determined to make it work for our year as a one-income family. We are just one of many in Union County that had to make a similar difficult choice about balancing our financial needs with the need to protect those that we love. The pandemic has had an immediate and negative impact on women in the workforce. In a study published in March 2021, 23% of women with children under the age of 10 had to either quit their jobs or consider downshifting their careers to be able to facilitate their child's education. While this is a national study, the stark reality here in Union County is even more sobering. School resignations are on the rise, and the ability to fill those vacancies is getting harder as our Board of Education has taken little to no responsibility in maintaining a safe work environment. I myself, being fully vaccinated, thought I would return to the classroom this year, but this Board of Education has shown me that they are not interested in keeping teachers safe with a mask mandate. At the end of September, UCPS had 175 vacancies. This number is increasing monthly and now stands at 183. In addition to not physically having the staff necessary to keep schools running smoothly, 203 staff have missed work because they caught COVID, and over 1,100 staff had to miss work because of exposure. While the teachers in schools are doing everything they can to account for the loss of face-to-face time with students, completing assignments via Canvas is not going to make up for the thousands of hours of instructional time lost as it stands currently. The solution is simple, and we as educators are frustrated that politics is continuing to play a role in this decision. Universal masking would alleviate every problem I've talked about today. A mask mandate in our schools would not only keep your kids and teachers safer, but it also keeps our economy strong, as parents do not have to scramble to find coverage for their jobs, or worse, have to quit when they cannot rely on our schools to be open. I am respectfully asking that this board consider implementing a mask mandate for our schools. Our teachers need this, and they deserve this support. I thank you for your time.
Thank you. Sally Murphy. There you go. I see you now.
Hi, good evening. My name is Sally Murphy, and I've been a Union County resident of Waxhaw for 13 years. As for the health and safety of our residents in Union County, I'm appealing to you for a mask mandate from a different perspective, the health and safety of our economy. I cannot speak as a qualified professional of healthcare or education. I'm a business major with 2 businesses of my own and a mom to 2 working UCPS teenagers. I can speak on authority to what happens to the Union County economy with and without a mask mandate. My examples are personal and from business websites. I can assure you the teenagers working at these businesses want to work. They want to spend their money in Union County and are a very important portion of our economy. The week of September 20th, my daughter had to refuse orders in her drive-through line because they didn't have enough workers to fill the orders. There are at least 6 UCPS teenagers working there. One is in her 4th block and they sit next to each other. With no mask mandate, if one of them gets COVID, they both get quarantined, and her restaurant loses not 1, but 2 workers for 5 to 10 days. With a mask mandate in the same situation, only the positive case gets quarantined and the other can continue to work. The same logic applies to working parents with quarantined children. In my businesses, my sales revenue and sales tax due are down. My personal property tax owed is down because I haven't needed to purchase supplies. Tuesday, September 28th, the Dollar General in Wingate couldn't open because they only had 1 person show up for work. Hilltop Fish Fair and Steakhouse on September 12th, they announced they no longer can serve breakfast. September 22nd, I went by Andy's Custard on Ray Road. They usually open at 11, but I was turned away without ordering because their employees were out with COVID or quarantined. The same day, I went to Bojangles on Providence. I spoke with the store manager, Ebony. She and another manager were the only two working. All scheduled employees had COVID or were quarantined or home with quarantined children. The week of September 20th, the Sun Valley Harris Teeter. 6 employees were out with COVID, and the store manager confirmed that area stores are now closing at 9 p.m. due to employee exhaustion, covering those out with COVID or quarantined. With decreased tax revenue, how will Union County stay operational and competitive with surrounding counties and states? How will all schools remain desirable with lower performance? A simple mask mandate keeps your favorite businesses healthy, growing our community with kids in school learning and they and their parents at work. Thank you for your time.
3 minutes time.
Thank you.
Thank you.
Taru Delawala.
Hi everyone, just checking if I'm audible and visible.
Yes, you are audible. Yes.
Thank you so much. I'm in a parking lot, so just wanted to make sure the connection is all good.
Your connection is good. I cannot see your face, but that's okay. We can hear you. Now I can. Now I can.
Okay, thank you. So good evening everyone. I am Turul Deliwala and I'm a Union County resident and a UCPS parent for over 7 years. I'm here to share my concerns regarding the decisions our Board of Education has made recently, as they not only directly impact the well-being of my kids enrolled in different UCPS schools, but also adversely impact the overall well-being of my family and our community. I would like to thank you for giving me this opportunity today to share not only concerns of my family, but the concerns that thousands of other parents and families currently have in our county. I have a kid in elementary and another one in middle school, and both my kids cannot be vaccinated since they are under 12. What this means is my kids are facing the threat of catching COVID every single day. They are at school with other kids and staff members that do not wear a mask. My kids wear a mask every single time they're out of house, be it at school or anywhere else. But school is the only place where they are confined in an enclosed place for 6.5 to 7 hours, that too in very close proximity with other kids without having much control over maintaining required distance when they're uncomfortable being around anyone without a mask, especially when the unmasked kids are coughing or sneezing as well. I understand there is a section of people who demand to exercise their right to not wear a mask as their personal choice, but I would like to remind them that personal choices cannot infringe safety of others in a public environment. That is the reason we have rules and regulations in place to ensure safety and well-being of everyone at school with respect to drug usage, bullying, even having a nut policy to ensure every single kid and staff member feels safe at school and doing what is right for the greater community. All these policies and rules were created keeping in mind the safety and well-being of the overall school community, even though it does take away rights of those who want to consume drugs or nuts for themselves at school or bully others as a right of choice of having fun. It has been proved in the recent weeks that contact tracing is not working in UCPS schools. UCPS staff members are overstressed and so many teachers have quit. Substitute teachers are hard to find and many others are on the verge of quitting to ensure their safety and of their families. Whereas it has been proved across the globe that masks are highly effective to reduce spread of this highly contagious disease. Last year, UCPS schools successfully opened in-person instruction at schools, but the key to that success was the mask mandate along with a dedicated staff, especially our teachers. This year, instead of following as is what worked really well last year, the Board of Education stripped our students and school staff members of the protection they had last year, which has led to increased number of sick kids and staff members, parents missing their work to care for their kids, and even some unfortunate deaths that could have been prevented. I plead the members of this board to follow science and experts, and please, please, please keep the safety of everyone at the top of everything else, as we live in a community, and that is what matters the most. Thank you so very much.
Thank you. Tara Mackey. Tara Mackey. We will come back to Tara. Jody McConkey.
Oh, trying to get my camera on.
Okay, we can hear you.
It doesn't want to turn on. Oh, okay. Can you see me?
I cannot. I can hear you
No.
though.
Okay, sorry. I don't know why it doesn't want to turn on. It was working a moment ago. All right. Is it okay if I speak without you seeing my face?
Oh, yes, ma'am.
Okay, just wanted to be sure. Okay, thank you. Well, my name is Jody McConkey. I'm a Union County resident of Lake Park for 18 years, a UCPS parent, and a former UCPS teacher. Tonight, I'd like to talk about how the Board of Ed's lack of a mask mandate is affecting our teachers. The following are some comments collected from an ongoing anonymous survey unaffiliated with UCPS. It's open to any UCPS staff member who is willing to share. Nobody asks teachers or nurses about what they need or want, and we are terrified to speak out. They insist we follow the data for our students, but the Board of Education isn't following the data from scientists. They are putting politics and personal bias above the health of students and employees. The board did a good job last year, but this year they totally left teachers and classes vulnerable to this virus. The board is not following guidelines at all, and they are manipulating data. Our staff has been demoralized. As educators, we need to teach our students to be responsible citizens, but unfortunately, the board is setting a fine example of how not to make educated decisions that benefit society as a whole. Reverend Kirkpatrick is a saving grace at each meeting, a ray of hope and light in the darkest of tunnels. We are never asked, just given orders and expected to do the work and keep our mouths shut. It appears as if the board discusses what they're going to decide before meetings even happen. We've been given no mitigation strategies for staff and students, no supply of sanitizer, no required cleaning protocol, no extra cleaning when an impactful case is identified. The board values freedom over everything else, but there's no true freedom for those who are losing out on an education due to being mask optional. A student brought home COVID to a family member who then passed away. The student is now trying to cope with having brought home the disease that killed them. There is no way we can ensure safe air quality in our buildings. We are not allowed to open our windows. To me, it feels like we are canaries being sent down into the mine to make sure it's safe for everyone else. Sure, we've made it, but if we hadn't, we would have been disposed of and they would have just brought in the next canary. A mask mandate would keep all healthy students in our rooms. Having students constantly in and out during quarantine and not being able to provide instruction is unrealistic in us being able to teach our standards. So a few more numbers for you tonight. 36.7% of those surveyed have been told by a parent that they won't test their child if they get sick. 56.7% said that parents are sending kids to school who should be in quarantine. 16.7% have had a student come to school even though they knew they're COVID positive, but 67.8% couldn't even answer that question because they simply didn't know. 41.1% are looking to leave UCPS due to the board's refusal to protect them. And finally, 91.1% want a mask mandate. These are our frontline workers and they deserve to be heard. Please, they deserve the safety of a mask mandate until our numbers and procedures are under control. Thank you for your time.
Thank you. We're going to go back to Tara Mackey. Tara Mackey. Catherine Shaw. Catherine Shaw, I see you're on. Hi.
Sorry, it took me a second.
That's okay.
So, hi, my name is Catherine Shaw. I'm a 9-year resident of Marvin and an emergency medicine physician. I'm very concerned about the health of our children in the public schools, as well as the impact this unsafe environment has on the most vulnerable in our community and our community as a whole. Since the beginning of this school year, the majority of the members of our Board of Education have shown blatant disregard towards the recommendations of the CDC, the North Carolina Department of Health, and the Union County Health Department. Several weeks ago, Dr. Elizabeth Tilson from the North Carolina Department of Health spoke before this board and the county commissioners, with the chairwoman of the Board of Education in the room. Dr. Tilson clearly stated that a mask mandate in schools was an important part of a COVID mitigation plan. Since that time, the Board of Education has continued to make masks optional. They've washed their hands of contact tracing, ignored opportunities to test in schools, and also obstructed the work of the Department of Health. And yes, the Board of Education may have signed a document stating they would cooperate with the Department of Health, but as you've heard here tonight, this is still a work in process. 7 weeks into school, and there is still not a fluid process to contact trace and quarantine students. This is a failure of our Board of Education. Let me be clear, students are not being contacted about exposures until 5 to 8 days after the exposure. This is in no way compliant with quarantine and contact tracing guidelines and is allowing COVID to continue to spread. Additionally, according to the guidelines, when a student returns from quarantine after a negative test, they should wear a mask through the 14th day after exposure. In our schools, there is no mechanism in place to ensure these children actually wear a mask as directed. I'm asking you, our Human Services Board, to consider our whole community. What about the single parents working multiple jobs that can't stay home with a child sick with COVID? What about the families without health insurance? What about the families where a high-risk grandma provides childcare while the parents work? What about the children with leukemia or bad asthma that are truly high risk for a bad outcome should they contract COVID? These people are our friends and neighbors, and these are the people who suffer the most when they are exposed to COVID or contract COVID. How many times and in how many ways does the majority of our Board of Education have to show and tell us that they feel their personal agenda takes priority over the health and safety of our community? Yes, COVID is trending down, but our numbers are still incredibly high, and there is still time to make a positive impact on COVID in our community. The Board of Education has shown no concern for the most vulnerable in our community, and the negative impact of their decisions extend far beyond the walls of our schools. Our county needs you all, our Human Services
30
Board,
seconds.
to consider the needs of our children, our most vulnerable, and the community as a whole, and mandate masks. It's the right thing to do. Thank you.
Thank you. Tara Mackey. Last call for Tara Mackey. Samantha Thomas.
Hi there. Good afternoon or good evening.
Hello.
Hello. I do not have a camera available. I've been trying for a little bit and it's not working, but you can hear me.
That's okay.
Hello and thank you. My name is Samantha Thomas, and I'm a Union County resident in Indian Trail, and I'm parent of a kindergartner in UCPS. And I want to ask for mask mandates in UCPS. As previously stated, the only way to guarantee student safety and keep our children in the physical classrooms is to have all individuals masked while indoors. Even Melissa Merrill, the Board of Education's chairperson, shared this advice to mask indoors on her public Facebook page. Masking benefits are common knowledge to the board. They continue to ignore the benefits in their decision making for various reasons that have nothing to do with the health and safety of children. We are around 37% of total cases in Union County that are children 0 to 17, according to Mr. Joyner earlier, and this is above the state average. And I believe this is wholly due to the mask optional status votes from the Board of Education. I've reached out to the governor, the Department of Health and Human Services, the Board of Education numerous times asking for this mandate, or at least a virtual option for my kindergartner who cannot yet be vaccinated. With every meeting, the vote is cast to remain mask optional. This essentially eliminates the ability for children to have the safest learning environment that is accessible to all and the right by law in this great country. When my child was exposed, my husband, our family's breadwinner, had to take 2 weeks of PTO to take care of her and her little brother. Now he will not be able to take time off at Christmas to spend with us. The data in our country, our county, our state, nationwide, and globally unequivocally shows that masking is the most easily implemented method to reduce community transmission of COVID-19 and its variants. As you know, the Board of Education decided to go against the state's Safe School Toolkit recommendations for mask optional schools and enforce a 14-day quarantine. Not only has quarantine been removed, but contact tracing has also been removed by the Union County public school system. All safeguards have been removed and the proven effective mechanisms of reporting have been eliminated. This causes communication to the parents in the event of a close contact taking upwards of 10 days. Most are not receiving a notice to quarantine or test or until days after the date suggested to test. Before these measures were removed, I was contacted by the nurse the day after a close contact exposure. Each of the days, these that pass is another opportunity for the virus to spread throughout the classrooms, removing
30
more
seconds.
children from their effective learning environment. I was specifically told that administrators in schools cannot enforce the 7 or 10-day quarantine for any close contacts. And also teachers are not allowed to reinforce masking for the 14 days as recommended for close contacts. So now we have a situation in Union County where we are forced into a situation where we are doing less than the bare minimum being communicated through the ineptitude of the board and the unfortunate powerlessness of the heroes working in our schools. I'm begging in this county to mandate masking and the quarantine recommendations in the Safe School Toolkit. Thank you.
Thank you. That will conclude our public comment section. I do want to round back to all of our division reports. Did anybody want to share a report tonight? Ashley, go ahead.
Thank you. I'm so excited that you actually saw my hand up with all of these people on here. So I wanted to take a moment because I know we have within the audience a whole lot of people who typically aren't part of our Human Services Board meetings. I wanted to take a moment and grab their attention because, as many of you know, I am the Director of Social Services. And so while I have your attention, I want to let you know that we are currently in need of foster parents. We have a good amount of foster parents who are available for children ages 0 to 12 or 13. We are desperately in need of foster parents for teenagers. So if any of you find it within your hearts to be a foster parent for Union County DSS, I would like to encourage you to reach out to me. You can reach me by email or phone. If you Google it, you'll find my number all over the internet. And if you need my email address, it's ashley.lantz, LANTZ, at unioncountync.gov. Thank you.
Thanks, Ashley. Tracy?
Hey, just real quickly, I wanted to mention that October 1st marked the date of the adoption and implementation of the 2017 Food Code in North Carolina. This is a fairly major milestone and really a culmination and a collaborative effort between federal, state, local agencies, industry, and universities. And so just a really big deal, and just wanted to mention that this evening.
Thank you, Tracy. Stephanie?
Hi, good evening, everyone. I just wanted to let everyone know that our Christmas Bureau has kicked off. Applications are all virtual. The phone number for that is 704-296-4828. So it's open to families, children, or disabled adults or senior adults.
Thank you, Stephanie. And I know that there'll be some volunteer opportunities out there too when it gets a little closer to time.
Absolutely.
Janet?
I also just wanted to let everybody know on behalf of veterans that the Warbirds over Monroe Air Show is starting back this year. So it was last year was not held. And that will be November the 6th and 7th at the Monroe Airport, which is 3900 Paul J. Helms Drive. And you can find the cost online, but the maximum is $15 or $10 for youth or $5 for current or former military servicemen and women. And any kids under 12 are free. And the Veteran Services opening ceremony will be on Saturday, which is November the 6th at 10:45 a.m. And we'll have Frank Cranford, who is our keynote speaker, who has a Purple Heart. He is president of Vietnam Veterans of America local chapter and dedicates his time to volunteering to assist veterans in need. And so this will be a special time. And if you guys have the time to come out, it would be something that I think you would find really valuable.
Great. Thanks, Janet. Anybody else? Lots of great work going on in our human services arena. So thank you for all that came and did the public comments tonight. Thank you for our department directors for coming and sharing and going over all this detail. I know there's a lot out there. And if nobody has anything else, can we have a motion to adjourn?
Motion to adjourn.
Second.
Okay, I'm going to call a vote so that we can make sure everybody's on the same page. Earl Ford,
Aye.
Meg Harkins,
Aye.
Richard Helms,
Aye.
John Laranzana,
Aye.
Jesse Lindberg,
Aye.
Eunice McGee,
Aye.
Dr. Smith,
Aye.
Megan Smith.
Aye.
All right, I hope everybody has a great Monday. Bye-bye.
Bye.